Good day everyone, I'm Ayla Reyes, your student nurse for today from BSN3D Black T. And for today's video, I'm going to demonstrate providing tracheostomy care. The goal of this procedure is that the patient exhibits a tracheostomy tube and site free from drainage, secretions, skin irritation, or breakdown. These are the equipment that we need to check for. First is the bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit if available. Be sure to collect supplies listed that are not available in the kit, or 2 sterile 4x4-inch gauze pads, sterile cotton tip applicators, sterile tracheostomy dressing, pre-cut and sewn surgical dressing, sterile basin, small sterile brush, pipe cleaner or disposable inner cannula, small brush, roll of twill tape, tracheostomy ties or tracheostomy holders, scissors, pulse oximeter, stethoscope, clean gloves 2 pairs, mask, goggles or face shield, hydrogen peroxide, and PNSS or sterile water. For the implementation, first, we need to bring necessary equipment to the bedside stand or over bed table. Perform hand hygiene and put on PPE if indicated, and then we need to identify the patient. Close curtains around the bed and close the door to the room if possible, and then determine the need for tracheostomy care and explain what are you going to do and the reason to the patient, even if the patient does not appear to be alert. Good day, ma'am. I'm Ayla Reyes, your student nurse for today from the BSN3D Black T. And today, ma'am, I will be providing you a tracheostomy care so that your tracheostomy tube or the site will free from drainage, secretions, irritation, or skin breakdown. Next one is adjust bed to a comfortable working position, usually elbow height of the caregiver. Lower side rail closest to you. If the patient is conscious, place him or her in a semi-Fowler's position, and if the patient is unconscious, place him or her in a lateral position facing you. Move the overbed table close to your work area and raise to waist height. Next is check for the lung sounds and place the towel below the trachea site, covering the neck and the chest of the client. Then, put on face shield or goggles and mask, and then suction tracheostomy if necessary. If the tracheostomy had just been suctioned, remove sole site dressing and discard before the removal of gloves used to perform suctioning. Prepare basins and cleaning solutions. Mix sterile water or PNSS and hydrogen peroxide in one basin for 50-50. Be sure it will fill the basin 0.5 inch. And next is add another PNSS on another basin and fill it at least half inch. Next is perform gloving. For cleaning tracheostomy, first remove the oxygen source if one is present. Stabilize the outer cannula and the faceplate of tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Press stops and release lock. Gently remove the inner cannula and place it in the first basin with PNSS and hydrogen peroxide and let it submerge there for a few minutes. Simultaneously, gently slide the tracheopod or the dressing downward and then discard and check for some exudates or drainage, skin breakdown, irritation, and inflammation. Next is clean the inner cannula of the trachea tube using the prepared PNSS with hydrogen peroxide and use brush to remove solidified or sticky mucus. Rinse it using the second basin with PNSS only and then discard gloves and put another gloves if necessary and then dry the inner cannula using the sterile gauze or pods and then gently reinsert it back into the tracheostomy tube. Be sure it is properly locked. cotton tip applicator or the gauze sponge in a cup or basin with sterile saline and clean the stoma under the faceplate. Use these applicators or sponge only once, moving from the stoma outward. Next is pat skin gently with dry 4x4 gauze sponge. Slide commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4-inch dressing under the faceplate. Next is check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably and then reapply oxygen source if necessary. Then remove gloves and assist patient to a comfortable position. Raise the bed rail and place the bed in the lowest position. Remove additional PPE if used, perform hand hygiene, and do the documentation. Reassess the patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds.